Hi guys, welcome to Pre-Hospital Hub. Today we're going to take a look at ECG recordings, which includes lead placement, and we're going to explore the paper that is used to show the ECG when printed. So, understanding ECGs, also known as electrocardiograms, can aid in diagnosis and treatment of a wide array of cardiac conditions. However, if ECG recordings are not conducted or recorded correctly, it can lead to potentially incorrectly diagnosing life-threatening conditions such as a STEMI. Equipment, electrode placement, artifact, and other human factors could produce an incorrect ECG recording. So artifact in ECG recordings refer to the unwanted interference or disturbance in the ECG waveform, which does not represent the heart's electrical activity. So there are a number of reasons artifact occurs. So firstly, electrode displacement. So this can occur when one or more ECG electrodes become partially or completely detached from the skin, or they shift in during the recording. This can lead to irregular waveforms, baseline wandering, so when the baseline should be flat across the page, but then when it goes above or below that line, it's classed as baseline wandering, or it can lead to electrode noise as well. An example of this would be, say you had a clammy, sweaty patient, then the electrodes would not adhere to the skin as one would expect. So then we've got electrical devices, so electrical devices such as mobile phones or smartwatches or any other electromagnetic sources can introduce again interference, and this may appear as irregular waveforms or noise on the ECG. Thirdly, we got incorrect lead placement or lead wire noise. So if we incorrectly place leads, it can lead to abnormal waveforms or inverted waves. Lead wire noise can be caused by damaged or poorly shielded ECG cables. It can introduce high frequency interference such as sharp spikes or irregularities into the ECG recording. We've also got respiratory and muscle artifacts. So this occurs when doing respiration, when we have chest movement, or muscle artifacts when we have skeletal muscles that contract near the electrode points. This can be caused by patient movement, shivering, or tremors. These artifacts often manifest as rhythmic disturbances, and can often again see baseline wandering. And lastly, we've got electrical interference, so from power lines or electrical equipment. This is also known as AC interference. So often you might go into a patient's home that is sat on a chair that is electrical, and most of the time you have to turn this on to get an accurate ECG recording. So if we move on to limb lead placement. So limb leads record electrical activity between two electrodes placed on the patient's limbs often. Various views can be seen on ECGs, which is covered in the ECG electrical views video. So limb leads are labelled as lead R, or also known as right, lead L, left, lead F for foot, and lead N for neutral. And these cables are also colour-coded red, yellow, green, and black. So we've got lead R, or red, which is often placed on the patient's right inner wrist. We've got lead L, or yellow, which is often placed on the left inner wrist. You've got green, which is placed on the left leg, and you've got black, which is placed on the right leg. A well-known mnemonic that can help you remember these limb lead placements is ride your green bike. So for the first letter of each of those words, you've got red, yellow, green, and black. Whilst on the road, you might see differences of opinion on limb lead placement. However, gold standard is that that placements should be placed on distal arms and legs, near wrists and ankles, rather than torso or chest. However, there are times when this might not be the case. So if we move on to the precordial leads now, so precordial leads record electrical activity from various angles in the frontal plane. There are 6 standard precordial leads, V1 to V6. So, and the 2 landmarks that we will use are mid-clavicular line and the mid-axillar line. So V1 would be placed on the 4th intercostal space on the right of the sternal edge. So finding the correct intercostal spaces is important, and this should be carried out by finding the sternal notch and then going down. So the sternal notch for this example is here, and the sternal notch is classed as the first intercostal space. So we count down, so 1, 2, 3, 4, and that's where we would place our V1 lead. V2 is placed on the left of the sternal edge, again in the 4th intercostal space. And then we would skip V3 for the moment and move on to V4, which is the 5th intercostal space, mid-clavicular line. And then we can go back to V3, which is placed midway between V2 and V4. We've got V5, which is the anterior axillary line in the same horizontal plane as V4. And then we've got V6, which is mid-axillary line aligned with V4 and V5. So just an overview now. So we've got limb leads, basically on right, left leg and right leg. And they should be placed on the wrists and the ankles. And it's often ride your green bike, so red, yellow, green, black. Now we've got the precordial leads, which uses the main landmarks of the mid-clavicular line and the mid-axillary line, and the 4th intercostal space for V1 and V2, and then the 5th intercostal space for V4 to V6. So looking at the ECG paper now. So ECGs are made up of many vertical and horizontal lines, which as a new learner can be daunting. So if we look at the horizontal line first and the one that goes across, so the horizontal line represents time. And standard speed for ECG recordings is often set as 25 millimeters per second, which makes it easy to measure time intervals, calculate heart rate, and it also allows consistency when comparing ECGs across different healthcare settings and over time. So if a patient has had an ECG recording, say a year ago, and they've saved it, then you can compare that to the ECG recording that you'll take. So when set at 25 millimeters per second, each smaller square on the paper represents 0.04 seconds or 40 milliseconds. So we often look at small squares and then we look at larger squares as well. So a larger square is made up of 5 smaller squares. So when we look at a larger square, the time for 5 smaller squares or 1 large square represents 0.2 seconds or 200 milliseconds. So it's important to note that when recording ECGs, just check the time settings, the speed settings, because in some cases, varying the speed settings might be needed to have a more detailed analysis of specific segments. So and this is often the case when you look doing a stress test, for example, with an athlete. So for that, it's often using 100 millimeters per second. So again, one small square, this time would represent 0.01 second or 10 milliseconds. And one large box or 5 smaller squares represents 0.05 seconds or 50 milliseconds. So at this speed, the ECG waves will show longer, which allows the segments to be seen in more detail. So if you're looking at different speed settings, so 100 millimeters per second basically means for every second of electrical activity, 100 millimeters will be printed. So say for 25 millimeters per second, so for every second of electrical activity, it will print on 25 millimeters. So moving on to vertical lines now. So this shows the amplitude, which measures the height of the ECG waveforms. So standard amplitude calibration is 10 millimeters per millivolt. So for 10 millimeters, it would show 1 millivolt. So again, looking at 1 square, that would represent 0.1 millivolt, because 1 square equals 1 millimeter. And then if we're looking at 5 squares, or 1 large box, that would represent 0.5 millivolts. Many ECG machines have gain or calibration control that allows you to adjust the amplitude setting. So by changing the gain control, the amplitude in the ECG waveform would increase or decrease. So a higher gain would show the waveforms as larger, while a lower gain will show them as smaller. And this predominantly is used to enhance the visualization of specific components such as the P-wave or QRS complexes. So a brief overview now. So the standard speed is 25 millimeters per second. So for 1 small square, which equals 1 millimeter, that equals either 0.04 seconds or 40 milliseconds. And for a large box, which represents 5 small squares, that is 5 millimeters, which represents 0.2 seconds or 200 milliseconds. And then the amplitude, or the vertical distance, so that is often measured as 10 millimeters per millivolt, and 10 millimeters, so 10 small squares would equal 1 millivolt. So I hope you found this video interesting on ECG recordings and helpful. If you want more information on ECG recordings, then you can visit our website at prehospitalhub.co.uk. You can also test your knowledge on ECG recordings using our quiz, or if you have any other questions around this or any other pre-hospital topic, then you can use our Q&A forum, which is also found on our website.